Let's speak now to Dr. Brian Kayne. He's a senior clinical lecturer at the University of Exeter Medical School and has worked as a consultant in communicable disease control for local authorities and Public Health England. Thanks very much for your time today. What is your first reaction to hearing the Prime Minister there encouraging people to think more about going back into the workplace from the 1st of August, potentially?
What is very positive and nice to hear is that finally local authorities are going to be given the powers to act on local outbreaks. I think this is the game changer. People like myself have been saying this for a very long time, that we need local people, local experts in charge of local outbreaks. And for us to see this local authorities now taking charge is a good thing. What I would really like to add is, whilst a number of dates have been mentioned as, the date to start so and so and so and so, what we also need is good data to know the level of virus in the community. So if we know case numbers are up, we take precautions. If case numbers are low, we are a little bit more relaxed, and that we must have in place as well.
Is it easy, though, to communicate effectively, in towns, cities, even smaller areas than that, in order to be able to control it? That relies on very effective communication, at least, doesn't it?
It relies very much on local communication, local experts who are known, respected, and trusted, as well as that local small area data, because what we want to do really is early warning signs. And as soon as we pick up a local area in a local city is showing more cases, we go in there and put a stop to it. And we go in there knowing it may be because they're congregating, there is a club there, there's a factory there or something, that fine level of data, so that we can stop it as early as possible.
At what point do you have so many local lockdowns that actually it's easier to have a national message?
I personally think we will never have a national lockdown again, ever, because it just isn't possible, as we've just seen, to have another lockdown. But what we will need is maybe a regional approach if there are lots of little lockdowns, as you've just mentioned. I can't foresee the whole nation going into another lockdown.
And how successful, for example, is it working at the moment in places like Leicester and in the northwest, where we've seen spikes in the population?
So we've noticed in Leicester, eventually a lockdown was imposed, and now the case numbers have come down. But what we really want to do is extensive testing, so we have with precision the knowledge of, are the cases really down? And also very important, look at other data, because not everyone is being tested. So see if the GP consultations are going up or down, and same with, for example, A&E attendances, what's that looking like? And that will give us a more comprehensive picture of, what is happening locally.
OK, Dr. Brian Kayne, thank you very much indeed.
Thank you.